The water's fine, homie, jump into the deep end. Sow it, you will reap it. We talking how to start it, how to grow it, how to keep it. Take a deep breath. You are now rocking with Founder Secret.
Ali, very nice to have you on. Welcome.
Thank you for having me, guys. Thank you for having me.
Ali is also an EOer, Entrepreneur Organization, our main sponsor. Just kidding. They're actually not a sponsor. We just have a lot of folks from EO that have joined in the past, and we love talking about the value of peer groups. Ali, you are a physician and also a teacher. I'm curious, you went to Stanford, you have been an anesthesiologist, as well as done general surgery. Are you a surgeon as well as an anesthesiologist?
No. So there's just two ways really you can go about being an anesthesiologist. You can go through a 4-year track that's, integrated, where you do a little bit of internal medicine, a little bit of surgery as your intern year, and that's technically called like a categorical training program. And then there's the advanced program where you decide to do either 1 full year of general surgery or 1 full year of internal medicine, or what they call a transitional year, which is a little bit of everything. And that's your intern training. And then after that, you have enough knowledge to basically jump into either, the field of anesthesia or radiology or whatever specialty you're going into. So I chose to do a year of general surgery. I love being in the operating room. So that was a kind of an easy decision for me.
How many years do you think you've spent getting ready to be a physician?
A lot. I think the number is probably around 18 if we're including undergrad. So undergrad is 4 years. Graduate school was 2 years. I took a year off before med school to do consulting. Med school is 4 years. I did a research year in medical school. So that's 5. And then after medical school, I did my postdoctoral training, which was 2 years. So that's 4 to 5. That's 11 plus another 2 years of my postdoc. And then I did 4 years of training for anesthesia. That's roughly around 17. I was going to do head and neck surgery, but then I switched from head and neck surgery into anesthesia. So that's an extra year of actual training and not degree collecting. So a total of 18 years. Has been a while.
So was it worth it? Do you think was it worth what you put into what you are now?
Putting them on the spot.
No, it's a good question. There's two ways to look at this. There's a principle in economics where it's, people decide not to do something because of the amount of time they've invested in a prior, engagement that's not related. I forgot the term.
Sunk cost.
Exactly, sunk cost. People could look at it that way. I never thought that I would be in this position. The plan was always to be an academic physician doing research at a university hospital. So my research background and my medical training was what I needed to do. And that's, par for the course. So, is it worth it? From a financial standpoint, probably not, but from just a developmental standpoint, I definitely think so. And the reason why is the rigor that you have to go through to kind of go through this process, your attention to detail, having the privilege of being a physician. I'm 100% right now in my startup, but the ability to always go back and practice is there. And that's something, it's just, I'm always going to have that. So it was definitely worth it. And it's all problem solving at the end of the day. If you have the ability and the know-how, and if you solved complex, problems that span over a period of time, I think that's a transferable skill to being an entrepreneur.
That's a really good point. I love that. It's almost like having a backup. A lot of people think entrepreneurs go burn all the boats, no backup. But I remember when I also first endeavored, I played tennis for a bit, and my backup was I could always teach tennis if all else fails. Yeah. So always de-risking things. So then what made you actually take the jump and become an entrepreneur?
It was, I guess, serendipitous. The last year of my anesthesia training was spring of 2020, which was, the pandemic hit March 11th. And, I was on an OB anesthesia rotation, and we had a patient that came in for an emergency C-section that was COVID positive. And residents are usually the ones to get in to the operating room the first and get everything set up. So it's kind of a rush to get in. I don't know. I think I had all my PPE equipment. I really don't remember, but somehow that was the only patient I had that week that was COVID positive. And the following week, I started to develop symptoms. The baby was fine. We got the baby out. The mom went to the ICU, but a week later, I'd already seen my parents unknowingly that I had caught COVID, and I gave it to both my mom and dad and my sister. And the frustrating thing about that was, even for physicians in my residency program, figuring out if you were part of the med school or the hospital to go get tested and what the quarantine rules were was just so unregulated. So I went back to work after 3 or 4 days of being out, and really that you're supposed to quarantine for longer than that. And, just the general guidelines was just very unclear. And I'm thinking, I'm come from a family of doctors. My dad's a doctor. My sister's a doctor. We all got sick. We didn't know what to do. And, we're the ones that, not that anyone is any less important, but you need the physicians to stay, virus free to treat the patients. And we didn't even have an understanding of how that was, being regulated. So that bothered me. And what ended up happening was my parents were inundated with patients trying to get tested. They didn't have the equipment. I do have a research background. I've worked with PCR, setting up PCR in hospitals before med school. So I helped them get set up with their lab portion. And they said, you should do this in New York. I think it'll be a really good project for you. And I wasn't really interested because I just finished my anesthesia training. I wanted to practice. And I slowly got around to getting the licensing to open up a lab in the state of New York. And the idea was to triage patients that were not sick enough to go to the emergency room, but still needed to be, they needed care. And we were serving both as the clinic component where we're evaluating the patient. And we also had the lab in-house as well. So it was a quick turnaround time. And that was kind of the impetus of how all this started.
So it's pretty recent. So you started it 3 years ago. And looking at your website and on LinkedIn and everything, that there seems to be kind of this emphasis on testing and, PCR testing. Is that the kind of main emphasis of the business?
That was what we did. And we just focused on direct to consumer lab testing for the COVID space. As we scaled up, I had to build out a team. We ended up having, teams of 4 different countries. We had to start automating the process. And I started to reflect on my experience. I trained at Cook County in Chicago, which is a public hospital. And then you compare that to Stanford, and there's, the level of care varies, the culture varies. And I started to think about how outpatient care in New York is delivered. And I said, there's a lot to be improved upon here. And it's not necessarily in the actual delivery of the care, it's everything around that. And I said, well, we've already set up systems here. How could I improve upon this? And I started to think about where do I think medicine's going and how can I use what I've learned to apply that moving forward. And that's when I started to think about developing what I call a health hub. And I think that's where care is really moving in the future, not necessarily in the hospital setting, but a lot of the stuff that we used to do in the hospital is going to move to the outpatient setting because it's cheaper for the insurance providers. They want to encourage that. It's a quicker turnaround time. It's less cost. It's more convenient for the patient, and setting up an infrastructure that really caters to that for the patient population is what we're looking to kind of pivot, grow towards now.
And just to level set, how many locations do you have today?
So we have 4. We just acquired. We're opening up a 5th one. At the height of the pandemic, we had 8. Yeah, and we just kind of no longer needed those locations given the volume, and we kind of are shrinking before we grow again right now.
How many people total are involved in the organization?
Yeah, so at the height it was around 200. Now it's around 70 to 80. I'm not quite sure the exact number.
That's hard, right? I think with COVID, I see this in the pharmacy space. People had to scale up quickly, scale down quickly, and a lot of businesses got killed because they couldn't scale fast enough one way or the other.
Yeah.
And so how did you manage to stay so agile, you almost have to foresee what's going to happen a few months ahead, because if you react by the time it happens, then you can't let everybody go in one day, you know. So yeah, how'd you do it?
So that's something that I'm always striving to kind of perfect. I don't think you're ever really going to reach that level where you feel like you've just nailed it right in the head. We started out, Flavio, you're not from here, I'm not from here. We kind of had that foreign mentality where you gotta, just do things as efficiently and as cost effectively as possible. So
Taylor's from Kentucky, which might as well be a foreign country too. So he just
compared to New York. So we had I didn't enter in long-term leases. The build out was, tailored for volume, not aesthetics. We we're trying to be as efficient and as scrappy, but as, yet still providing good care. And that really lowered our costs. I think that, I've had, competitors who I've been in the space kind of grow very rapidly, and they were national. They had a national presence all over the country. And it's hard to regulate when you grow that quickly. And then, downsizing the expenses from that level is difficult. You can't just, it's not that easy to do. So for me, I've always tried to just be mindful of the costs. And I knew that I had to get this up and running quickly, because we never knew how long the pandemic was going to go on for. And then once we started to see that the volume was trending down, we tried to, balance growing in the new direction that we want with kind of downsizing in a way that's best for the organization to stay viable.
Can I go to you were talking about the health hub idea. How do you feel about, all these sensors that are kind of in the market? You have the Apple Watch sensors, you have people getting, normal people, not physicians, but like normal people getting more and more. So as an aside, my brother 3 days ago woke up from sleeping in the morning, and his Apple Watch had told him he had like 3 cardiac events overnight while he was sleeping.
Yeah.
AFib and irregular heartbeats. He ended up going to the emergency room. They said, "Yes, how'd you catch this?" And he's okay, thankfully. But it created this whole infrastructure he would not have known about, right? If he wasn't wearing that Apple Watch at night. And I'm just curious, like when you think, you as an entrepreneur and as a physician, like how do you think about technology with people, sensors, and what do you think about that kind of thing?
Yeah, I'm very much interested in that arena, and I really want to get involved in that. And I think it's where medicine's headed. I think it's a great way to empower and engage patients in their care. And an empowered and educated patient is a confident patient that can make the decisions that's best for them. So I think that we should be embracing this. I think that there's a lot of adoption that we have to really work out and figure out what data points are the most important ones and how do we deliver that to the patient so they can understand it. And we're, down the line, I'd love to be able to integrate Bluetooth technology into an app that can be fed into an EMR for a provider to remotely monitor the patient. I feel like they're going to come up with sensors in your toilet, in your, mirrors to check for, the consistency of your stool, the, pupillary reflex, or, any kind of signs of glaucoma from looking in the mirror and analyzing that. So there's a lot of advances in that area, and I'm really excited for it to kind of just learn more about it and be a part of it.
I love it. Do you think that some physicians will feel, I don't know, scared is the right word, but they'll feel intimidated, or that they will resist what were, these sensors and things?
Yeah, I think you're never going to get 100% adoption in a given field. That's just, how it is. That's par for the course. And I think that that's from people having negative experiences themselves, or someone close to them had a negative experience. That's for just fear of feeling left behind. It's understandable, but I don't think that that's really going to halt there's too much momentum that's gained right now. And I think that, for them, everyone's entitled to their opinion, and there's there's different types of care for different needs and different styles of which patients can, get the whole gamut. But we need to figure out how to make medicine more efficient, more accessible, more transparent. And I think technology is the new way that we can address those issues moving forward. So I think overall, despite what, minority people, I actually don't know if there's a minority or majority that are for this. I'd say minority. But despite that, it's still grabbing enough attention of the people that, it needs to grab their attention. And I'm excited to see where this goes.
So I'm curious, what's the challenge about being in New York and marketing to patients, right? You got a lot of people, but I'm also a lot of competition. So is it, how do you go about people picking you? Is it mostly just seeing you in your location? Is there another channel?
So, the good and bad about living in New York is that, you have, I don't know, in Manhattan itself, like just over 1 million people in terms of population, in a very highly concentrated population that are, of a certain income bracket that makes it, it's a plus to have. However, these patients are also very more demanding and less forgiving than most other patients in other parts of the country. They expect things quickly because that's what we have in New York. We have access to care or other, you can get food at, I don't know, 3, 4 in the morning and it's not a problem, versus in other cities, it's not that easy. So they're accustomed to a certain level of just convenience, and making sure that you're providing that for them is difficult in a competitive market, in a market that, everyone's bidding for, Google ad dollars to acquire the attention of a patient. And it's not easy, but there's also a lot of opportunity there. So I think it's really understanding how to navigate each, your respective field with regards to the marketing, and if it's to a client or a patient, and making sure that you're figuring out what that formula is, and then and developing and growing on it.
Is it like restaurants where I've been told it's all about location, and there's restaurant is a bad corner that people have tried opening restaurants 5 times there and it fails every time? And I'm wondering, is it similar in your space where it's all about finding the right location, and then the clinic will, like the Sweet Green and Meatpacking, I know it must be raking it in, because of that location.
I've dealt with that question, time and time again for many reasons. And my answer to that is yes and no. And it really depends on where you are and your stage of growth as an organization. Gucci can afford to have a store on Fifth Avenue that is taking a loss, because it's great advertising for them, and people will go home and order, whatever product they want online from, Gucci online store. I was always big on trying to get locations on avenues, not streets. But then I saw Summit Health set up a clinic on 19th Street between 5th and 6th, and they're busy. They're doing well. And I've seen, One Medical open up a clinic on the 5th floor of a building in Flatiron. And they also have a healthy volume to sustain their overhead. So I think that if you have good marketing initiatives online, you can be in these nooks and cranny like locations, but it's always going to help to be on a 6th Avenue or a 5th Avenue. The question is, how much are you paying for that, and how can you measure the return on that location versus being, on a side street? So it's really very specific to each individual's, unique set of circumstances.
I noticed on your website, you kind of emphasize open late every day, no appointment necessary. I assume that's speaking to kind of the convenience aspects that you were mentioning. And then there's this under wellness, the first result is weight loss. And it goes to talking about kind of the very hot drugs of the day or this year around weight loss. Like how do you feel about those as a business? Because it seems that, it's like a booming opportunity, I suspect.
Yeah, so that's a very loaded question. So there's, let's look at it from a business perspective. We Well, okay, let's take this from, the initial like overall health hub ecosystem perspective. You want to provide a multitude of high volume, high yield services that are going to benefit the patient. So what do I mean by high volume, high yield? Meaning that it's a service that a majority of the people in your 1 to 6 classification, and if you're an ASA 1 or 2, you're generally healthy with a few, you may have hypertension or something, not so, something minor in its early stages. Our health hub ecosystem is catering to that patient population, which is a majority of what New Yorkers are. The hospitals are going to take care of the more sick patients. For those patients, we want to make sure that we're offering the majority of the services that they're going to need from the specialists that they're going to need. So weight loss is one of those things that it fits, multiple needs for us and the patient, in the sense that we need to still, as we're pivoting, we need to find a service that we can get people in the door to generate revenue and build our patient base, while also providing something beneficial to the patient that they want. Now, the weight loss initiative in general is there's a lot of nuances to that. And the reason why I say that is, the whole perspective of like body image is a big thing. And, is being overweight a bad thing? And does that affect people's mentality? What's the cultural impact on that? And then these meds are expensive. We talk about access to care. Well, a lot of people can't afford these medications. So there's a lot of things that a provider and an healthcare organization has to be aware of and sensitive to when delivering these kind of services to their patient population. But there's also a lot of benefit as well in terms of patients who are diabetics and their cardiovascular comorbidities down the line that are associated with, diabetes or obesity, that they're being, they're still Novo Nordisk is still waiting on a rather large 17,000 patient study to come out later this year to really talk about the cardiovascular effects of these medications. And if they're said to show us a statistical significant difference in the Mounjaro versus the placebo, then a lot of people are going to continue to want to use these medications. And I think that I'm hoping that this will be something that will be beneficial to the patient population at large.
It's interesting. We're talking about GLP-1 drugs, which have really boomed in popularity. It seems like everyone in Hollywood started taking them, and now, and it's almost interesting because some of those folks I wouldn't think have any weight loss, I guess, desires. Maybe, like, I'm wondering. And you have a location in NoHo, and if having walked through NoHo, I wouldn't associate that with a high population for demand for GLP-1s for weight loss, but maybe I'm wrong. Or is it people that just want to suppress their appetite regardless of whether they have diabetes or not, or regardless of whether they have a weight loss problem or not?
It's a little bit of both. And I think that you're going to get a different patient population based off of your geographical location. We definitely do see patients that have a BMI under 25 that are, wanting to drop 15 pounds before a wedding, that don't have cardiovascular problems from their diabetes. And, it's a touchy subject when you have people that are like trying to get access to these medications that are actual diabetics needing them versus people that
also, I have another question. Sorry, I'm so excited by this topic. I have another friend who started taking it and first was like, oh my God, this is a miracle. I'm no longer hungry at all. It's perfect. But then months have passed and seems like not much has changed. Like, it seems like there's a reversion to the mean after a while. Or do you think that there is like long-term sustained progress with these meds?
So GLP-1s are agonists, are really kind of just suppressing. Well, when it slows your GI motility, so you have feeling of fullness quickly because your digestive tract is just not moving through digesting the food as quickly, and your desire to eat is decreased. And that's only while you're using the medication. If you were to stop using the medication, people do report gaining weight. The question is, do they gain weight back to their baseline, or do they reset to a new baseline? And has that affected their eating habits? And I think that you will see a lot of patients gaining weight. It's just a matter of like, how much weight are they gaining back? And the big thing that really needs to be supplemented with taking these medications is understanding your eating habits and how to make changes with regards to your daily, caloric intake, which is just as important as being on these medications.
I'm getting married this year, and I've thought about these, to Flavia's point, I've thought about these, and then that there's, how do you, because there have been many weight loss drugs throughout history that they looked like a miracle drug, and then some of them end up killing people and things. How do you think of these things in your own kind of personal risk analysis, where you think, okay, is this at what point does something, not just this, but at what point does something become less risky for you?
Yeah, so we just want to refer back to what you're touching on. I don't know if you guys remember phentermine or ephedrine, hydroxycut, all these, cardio stimulants, resulting in tachycardia and cardiac arrhythmias. And
ephedrine's a great example. They were also suppressing appetite, kind of working that way.
Not in the right way, though. There's always going to be some level of there's going to be some side effect profile with the medication, and that profile varies based off of what the medication is. You really got to be up to date on the data that is surrounding these medications. You should be able to dissect the study and say, is this a legitimate study or not? What's the power of the study? You got to, just rely on the research that's out there and make sure that it's, as unbiased and as objective as possible, and make your own conclusions as a healthcare provider to see if this is really a medication that you feel is going to be beneficial to your patient population or not.
Very cool. All right. So bringing it back to the business side, I'm wondering, I don't know if you can share, what are the margins on these medications? Because they are very expensive. I mean, they're up to $1,000 or almost $1,000 a month.
So the medications are usually sourced by the pharmacy, and they're the ones that are buying the medication and selling it. And then if they're having it covered by insurance, it really depends on the insurance provider, the specific plan of the patient. So, it's kind of, I'm trying to find that answer myself too, where we really try to generate the revenue or the ability to sustain the service is the evaluation from the provider standpoint to say, are you a candidate for this or not? And if so, how do we guide you through that process?
I see. For you, it's more of a one-time thing. You're charged for the consultation. You're not the pharmacy.
Or sometimes we'll have the medication part as the packet, and then we purchase the medication from the pharmacy. We're looking to see if that's going to be an effective way, because we want to be able to deliver the medications quickly. And we're trying to figure out the supply chain dynamics of that right now.
Very interesting. Well, cool. What any other advice you have for entrepreneurs? It's so interesting going from being a physician to being an entrepreneur. So I'm wondering, what have you learned from your journey so far that you would want to pass down to the next generation?
I'm still trying to remind myself of these lessons. But I think the first thing is know what's your why. Why are you doing this? It gets tough. There's a lot of uncertainty. And when you're faced with that, you got to remember, why am I doing this? What is the point of this? That's a big thing for me. You're never going to have all the answers. So you have to, I'm trying to develop my decision-making capacity based off of values and not outcomes. That way, if you make the wrong decision, quote unquote, make the wrong decision, and it was value-based, or it was, based off of a methodology that you try to you implement and evolve, that's the best thing that in my opinion, that's what works. And then recording these decisions and the thought process that was behind them, so you can reflect back and say, okay, well, here's been the progression of how I have changed my decision-making capacity as an entrepreneur, because it's a lot about the decision-making ability and what you choose to do and what you choose not to do. Recruiting for me is a really big thing, understanding how to recruit good people, know who the players are in your industry, in your field. Every startup is part of some kind of community, unless they're pioneering something that's never been done before. And then if that's the case, then good for you. But you really, you want to know who the people are and figure out what are they doing, share ideas as much as possible, and just and develop yourself in a community or an ecosystem that's going to support and understand what your needs are.
You must have ramped up so quickly from being all focused on anesthesia to entrepreneurship. So I'm wondering, like, what resources or tools or hacks have you used and learned a lot from to ramp up so quickly?
I try to read as much as possible online about what's available. I try to figure out who's a good resource for marketing or who's a good research.
Like, what are some of those that you've used online, or what are some names or things that you remember?
So, obviously EO is a big help, and but that's been a very recent advance. That's been a recent resource that I've acquired. But, let me think here. In terms of resources, it's really, I don't think there's any one resource. So for billing practices, I will go online, and I think a lot of that, how to build codes or how to negotiate rates with insurance companies, you can read about that to a degree, or you can just reach out to either people in your circle, or just consider talking to a consultant, or the people that you interview for a certain position. You try to learn as much about the field from them, because again, you're new to this and they've been doing it for a while, in terms of like your CFO or your marketing director or whoever it may be. I spoke to other health physicians that are in the private practice sector, and how did you do this? What has been your experience? I don't think there's really kind of ever, right now, I can't think of like any one resource that I had, but also I'm the type of person that likes to talk things out, and finding a cohort or one or two people that can kind of keep up at your pace of thinking or discussion, and being able to throw ideas back and forth with them is also really helpful as well.
Totally. If people don't know this, you're right now, there's like a giant whiteboard with like a million ideas and implements. When I was sitting over there, we're like going back and forth. They're like pointing at the whiteboard. I definitely could.
My employees think I'm a maniac because I've like literally whiteboarded like as many walls as possible to just like write stuff on. So I think that's been like super helpful for me.
One other question I have is around, it seems to me as somebody not in healthcare, that health and health tech and, there's regulation, there's insurance, or, it feels like such a different type of industry or business as an entrepreneur. Is that your experience as well? Or when you talk to entrepreneurs who are not in health at all, are there learnings that you can pull out of that? Or is it really so specific to what you do that it's really only helpful if it's in your space?
Yes and no. So medicine is very highly regulated, and understandably so. So I'm kind of dealing with that is a little frustrating, because I think a lot of the technological needs have not caught up in medicine, whereas they have in like the retail industry. How you market, there's still HIPAA laws on how you can, market to certain individuals. But in general, a lot of the marketing principles that you would use for a tech company, you do the same thing with medicine. Accounting, a lot of that's the same. However, the nuance for medicine is you're billing what they call a CPT code for a certain thing that you've done for the patient, and how that's done and how that's justified and who are the people involved to, weigh in on whether that was done correctly or not is very nuanced to the medical field. But, keeping your books, up to date and in accordance with GAAP principles or, whatever it may be, that's really important. So by the way, back to the resource thing, my accountant was a very big resource, because I was very interested in learning how to make sure that, like, one, you're doing things the right way, and two, that you're being very savvy with your taxes, because that's, if you don't, why give money away if you don't have to, and it was rightfully yours. So really understanding that and having a good accountant was really helpful.
I love it. Well, any kind of final words of wisdom or anything that you'd like to plug for the audience? Maybe some of our listeners are in New York, so anything you'd like to plug, or any final words of wisdom?
Well, one, thank you for having me on. It was a pleasure. I really hope you guys launch this and it becomes a success. Two is, it's been awesome being a part of EO. I think that it's been a great resource, and I think that, we definitely I think we're all thankful for that. It's great to kind of connect with people that are like-minded, and that's been really refreshing. I guess the biggest thing is, why I'm still doing this is because I do believe that this healthcare ecosystem in the outpatient setting is the way of the future, and it's going to take a little bit of time to get there, but we're slowly adding on different services and being able to provide something that will be of value to the patient in New York and beyond that eventually. So come support ClearMD. Hopefully we can provide good care to you guys. We're very interested in making sure that people leave with good experiences. And yeah, thank you.
Thank you so much for joining us today, Ali.
Thank you, Flavio. Thank you, Taylor, guys. I'll talk to you guys soon.
All right.
Thank you. Cheers.
Thanks. Bye.
Bye.
Bye-bye.
Thank you for rocking with the homies. Taylor, Trusty, and Flavio. Seize the day, own it. Until next time, hold it down, hold it down.